Grandpa?
I'm the chair.
Hi, how are
That's
you?
my mother.
Nice to meet you. So I was looking here. So tell me, what brings you in, first of all?
Okay, I have my wisdom tooth that another dentist broke, and it needs like a filling, a temporary filling.
On the wisdom tooth? What if it...
It's how do you say, regenerating.
Okay.
And I also need the caps that's next to the wisdom tooth. That's what also causes the infection on my wisdom tooth to be cleaned out, because there is a lot of smell coming out from under them. And the other dentists refuse to take responsibility. And also, if I could possibly get this mercury out of my teeth, because they are whitening my teeth. It's eating up my bones, my gum. No, my bones under the gum. So that's why, because this doesn't like this so far.
Okay. The mercury has nothing. I'll say this: the mercury has nothing to do with the spaces in your front teeth. Okay. I do see a lot of happening on the top molars. You had a lot of root canals. Did you get any wisdom tooth out?
No.
Why?
Why should I?
Because there's a wisdom tooth that I see here that is in a position where it needs root canal, and it's not a restorable tooth. So that's why I thought you said that the tooth was broken when they...
They broke it. The dentist broke it. It was the wisdom tooth was whole until the caps, until they put it on these caps, and there's an infection going on under the caps, which infected my wisdom tooth.
Got it.
But I'm not having now problems with the wisdom tooth. I had first great pain. I went to the dentist, and what did he do? He broke it. He was so rough on it that he practically broke my wisdom tooth.
Okay.
But that wisdom tooth has no need to be taken out, because if you look, you could see that that it is the inside. It's completely straight. It's
I'm looking at this one.
Oh, that's the one. Yeah, this is what's giving the problem to this.
Yeah. And looking at this X-ray, because this is August X-ray, okay? This was March X-ray. There was a big cavity on that tooth, okay? And it looks like by that time, from March to August, you had a filling done on it. A temporary filling.
They put the temporary filling after he broke it.
Yeah, but not necessarily to break it. I don't know what was treatment planned, what happened at that time. What I do know is that my recommendations, looking at this X-ray, I would extract that. You were my mother sitting in that chair. I would tell you, Mom, that tooth has to come out.
Maybe you should look at it first and see how it is. But also the fact about the mercury, that's what's causing my teeth to whiten. I know that for a fact because I see what's been going on, because I pay very close attention to my teeth, and I know what's going on in my mouth, and I know what's causing it.
Yeah. Have you ever had gum problems?
Since the mercury, yes.
No. Gum treatment, gum surgery.
No. The fact that under the gums there is a lot of tar. Also, that's also because of.
No, that causes teeth to move. Okay? The tartar, the gum problems, causes teeth to move.
Yes.
The mercury had been in your mouth for 20 years, 30 years?
And that's ever since, that's how I've been having all these problems.
Yeah.
Ever since they started with this poison in your mouth.
Yeah, that's it. Today I want to fix whatever one problem is bothering you, and then we'll continue from there.
Alright, okay. Start taking a good look at what there is, and then start to know where to start first.
going to get an instrument. I'll be right back, okay?
Okay.
Il dentista che è vicino.
Ricordami per to get my x-rays done.
Yeah. Speriamo. Adesso non l'ho già qui.
Allora ci dico tieni tutte in mani.
Computer sto computer c'è mi sono
Yeah.
Sto piccino.
Yeah, it wasn't covered by the insurance. So if you want to continue, you have to ask how to So is it bothering you?
What is
Yeah. He needs to reevaluate your mouth.
what do you suggest
Oh, I don't. That you would have to let me know.
As far as?
excuse me?
As far as?
For the work, to be done.
First of all, I would need detailed x-rays. I'm just looking at a piece of paper which is kind of blurry.
Yeah, but
and it could give me false information about what
They
I'm
don't
looking at.
send you the X-rays from the other.
They could send it.
They could send it.
You have to request it.
I have to request it. I have requested my more than once my records of dental records. They've been giving me a hard time to get them.
Yeah, I have no control. It's your privacy.
I know, and I've been requesting it, so I have a right to have them, but they're giving me a hard time to get them.
Yeah, you need them. I could take the X-rays, but I don't know if it's going to be covered under your insurance or not. And if you had just recent X-rays.
That's why I brought these here.
Yeah, those are just
They
the paper.
they have the X-rays.
Yeah, I need just an X-ray to look at it in the computer. Okay, I want to show you something that you're not able to see.
Okay.
So you have an idea of why I'm saying.
This is X-rays?
No.
Or this is pictures?
Pictures.
Oh, this is cool. That's why it's called. Sorry. That's the wisdom tooth, right? Mm-hmm. It's black inside.
All right. So that's your wisdom tooth. That is the first stage. That's the first area I would focus on. Let me get some more images because I know you have questions about the mercury.
I could tell you that from the moment that you put on the mercury, my teeth have been fast forwarding in separating.
Okay.
It's been 2 years, and in 2 years, these teeth in the front have been separating like crazy and becoming more thinner on the bottom. They weren't like this 2 years ago.
We could put them together. We could put them straight.
I just want this mercury out of my mouth.
Yeah. That's it. Okay, so that's like the large one. That has, That's the one that has the largest mercury. Your insurance company?
I've contacted
They
my
have
insurance
policies.
company. I know.
They don't. I, as a dentist, cannot remove something if there's no reason for it to be. Okay? When someone comes in and tells me I want my mercury removed, that's a personal decision because of holistic decisions. Or cosmetic because they don't like the color of that.
It has nothing to do with cosmetic. Mercury is poison.
Yeah, but I want you to understand the situation. The insurance company is going to ask me, is there cavities? Is there pain? Then we're not covering.
There is. I just explained to you what it's causing.
No,
It's causing. Yes, it is. I'm telling. If you
can't
look
ju-
at my
that's not-
if
that's
you
not
look
a-
at my X-rays from 2 years ago, when I just started with the fillings and stuff, once again, you'll look at the fast progress practically it's degenerating of my teeth in the front.
Yeah. I want to be sincere with you.
It would not have happened if it wasn't for the mercury.
Yeah, I want to be sincere with you. There's only several things that cause tooth movements. Mercury for itself is not going to cause tooth movements. Okay? A filling for itself is not going to cause tooth movements. Tooth movements move because the bone is not healthy, because there's infection in the gums, because there's tartar buildup. Okay?
And where does that come from? Could you explain that to me?
The lack of hygiene, the 6 months recall from deep gingivitis. Gingivitis is inflammation of the gums.
Okay, where does gingivitis come from?
From the plaque.
And where does plaque come from?
The lack of flossing. It's a normal.
That's not true because I floss every day. I have the water pick also, and I've always taken care of that.
Yeah, mercury is just not going to cause
Fluoride?
Fluoride helps.
If you're telling me fluoride helps, then we're not on the same thing.
Yeah.
Fluoride is poison.
Yeah, and that's why it's in the entire New York City water supply.
Well, that's why a lot of people are having problems. You put fluoride and you put mercury together, thank you. You're gonna have this kind of amount reducted in this way.
Yeah. If you want your teeth straight, braces. You can get them done with braces.
We have to first take off what could cause the damage.
Yeah.
You start from the root of the cause that could cause all these damages.
Plaque. Hygiene.
Plaque. Foam.
What's foam?
I just explained it to you. The mercury, first of all, it's banned. I don't even know why the dentists are still using this poison.
Yeah.
Okay? I've done my research. I've been studying into this, really into this. Fluoride, I'm not even going to get into that. The poison that the damage that it causes, plus with the mercury.
Yeah. To further evaluate it, I would need X-rays. Okay. To remove it, we have to predetermine it to the insurance. They have to give me an answer. Why the removal and if I'm going to do it.
Yeah.
And it's about coverage, if they're going to cover it or not.
I've contacted them so many times, and I already had this discussion. Go to the dentist and see what they say. I said, yes. When I go to the dentist, they're going to tell me the same thing. If you don't give them the authorization to fix the damages that you are causing, I'm fighting against the insurance company. I'm honest. Yeah. And I'm trying to get everything changed also for the other patients because it's a money machine.
It's just.
It's a money machine.
I want to treat you to what you need.
I don't want to offend you. I'm not offending you.
No, you're talking about what you're doing personally as far as insurance. I want to be sincere with you as far as your treatment. I would need X-rays to give me a better detail.
Okay.
And I would recommend for that wisdom tooth to get extracted. It's a non-restorable wisdom tooth. It's going to cause an abscess. It's going to cause an infection.
I already had very severe pain on that. And I know what it is. And I haven't had that anymore.
Yeah.
So right now, if they would have extracted it, and now I'm not having that pain, so why is the reason that I should get it extracted when I know that it could regenerate if I get...
No, it's not going to regenerate.
Yes, it does. It's the same thing as liver.
My dear, I would like to understand and believe that it will regenerate.
It does.
But I can't help you if that's your belief.
No, I know for a fact because I know someone that had a transplant, okay, with the liver transplant.
But not teeth.
It does the same thing. It's the same thing with bones. The bones, it's the same. When you put braces on the people, it's to straighten them, right? So it does also, in a way, straighten the teeth.
Yeah.
Same thing as the tooth. It does regenerate.
What would you like me to do for you?
I don't want to tell you. Yeah. I wanted the mercury out and also cleaned out the caps because there's infection in there. You could see clearly there is an infection in there.
I need X-rays. That's what I would need.
You need now an X-ray?
Whenever
or the
I have
ones
to make
they
a decision
give you?
based on recent X-rays. Okay, and my recommendation as far as infection, as far as bad odor that you're having, will be from that tooth. The pus and infection that's coming out is coming out from that tooth, even though it's not hurting.
From under the cap. No,
from the wisdom tooth.
Oh.
You have root canals on those teeth. The two caps, you have root canals. On all four caps of yours, you have root canals. No infection, nothing should be happening. Although
if there's an odor coming out from under there, that means
the wisdom tooth. Trust me.
On this side too? I don't have.
No, the other one is the one.
And this is where the odor is coming out. So when I do with the water pick, I could smell the stuff coming out of there.
You see this space? You see this little black line underneath? I need to look at it under the X-ray. I need to see in detail if it's something that's going to be treatable or not. I need to know if there's cavities there or not. I need to know why there's infection or bad odor. You've done everything in your hand to sit down in the chair and get root canals, get crowns. Okay, but I
didn't want these things done, but I didn't know a lot of things, unfortunately.
Exactly. And you've had amalgams placed. You've had major work done. This tooth, my mother's sitting down in that chair, I would be extracting the tooth right now. Okay? I want you to understand. I can't give you more than the information I have here. You know, I can't do the change of fillings because the insurance has to get approval.
Okay, could you ask the insurance company?
We do submit predetermination. They're going to ask me for x-rays.
Okay, so if they, you can't use the x-rays that I had before that.
You have to send me those x-rays that
I
you have.
can't send them. I told them that they knew that I was coming here, so they're supposed to give you the information
I don't know where you
beforehand.
come from. I don't know who you last saw.
I seen 2-3 dentists.
Yeah, and they didn't want to do the work.
No,
Or they said
well,
the same
it was based on money. The one with about the wisdom tooth, another dentist, he goes, first he told me that I had to extract it. So I said, I don't want to extract it, I want to save it. He goes, oh, well. Then he looked at it, he goes, okay.
He tried to save it.
He said, no, it's going to cost you $2,000. So if I had the money, he'll save it. Don't have the money, just get rid of it. He'll just, so.
Yeah. I don't want to get rid of you. I want you to be healthy.
No, I'm saying, if I had the money, he would save it. I don't have the money, he says, that's it. He doesn't want to know nothing.
Okay, so I'll tell you this.
So it was
Get
based
the
on
tooth
money.
extracted. You've had 2 people recommend extraction. I can't convince you to do it. It's your right to make that decision, okay? I can't make you change your mind if that's what you truly believe.
I know. You can't just clean out the...
I'm not touching that tooth. That tooth has to come
And
out.
what about the caps?
I need x-rays.
Alright, so if I have to get the x-rays, would you do the x-rays?
I don't know what it is, what it entails. I need to see what's going to happen with that.
Okay, do you want to do the x-rays?
I need them to send the x-rays, yeah.
Okay, so I'm not getting anything done today.
I wish I had x-rays in order to give you a decision. You know, because
You can't request it?
It's your personal property.
I had to bring the x-rays, they don't send it to you?
You have to sign a form and request for them to release it.
You can't take x-rays now?
Yeah, we could take x-rays. If you just had x-rays, you don't want to take more x-rays.
I don't want to take x-rays when I know that they have the x-rays.
Exactly.
This is incredible, so I'm not getting anything done.
Okay?
So what am I supposed to do? Call my insurance and say that you couldn't do nothing because you don't have the x-rays?
No, because that's not the right. You don't want to take x-rays because you just had x-rays taken. These x-rays were taken in August.
Yes.
Your other office, where you came from, have the x-rays.
And these are the copies.
Yeah, I needed to put in the system.
And the insurance company didn't send them?
I send this to the insurance company. They're going to want detail. I can't diagnose anything from there. I need something that I could verify from the computer.
They want to see.
Yeah, I know, but I thought, just once you call the insurance company, they send it over to
The
you.
insurance company has nothing to do with your x-rays.
So the other dentist office. But
Yes.
they are the ones...
Call your dentist.
I
Tell
don't
them.
have a dentist.
The dentist you came from. The ones who took the x-rays in August. Or your 3 other dentists you visited from that you had x-rays. Have them send the x-rays. We'll look at the x-rays and we'll take
I
it from
thought
there.
it was in the system. That's why...
No, the insurance has nothing to do with the 3 different dentists. They're just providers. The dentists take the x-rays and that's for their file. My file needs x-rays right now. I don't have those x-rays. You don't want to take x-rays, but you need x-rays.
If I have to take x-rays, I'll take them at this point to see the difference then from the from one to the other. But then...
Excuse me?
Thank you.
Yeah, she needs to go for her hygiene.
Okay, and then also are you gonna send her to get the captain?